All right. Well, I will be respectful to everyone who got here on time. Of course, if you've tuned into any of our previous webinars or come to any of our events, you'd know that my dream, my capitalist pig American dream, is to create what's called a family office, but a family office for the mass affluent, millionaires next door, people like my mother and father, people who pedaled uphill, who clipped coupons, who drove cars till the wheels fell off, did everything in life right. And I'm of the thought these people sometimes suffer a level of financial sophistication that's far below what they deserve. The wealthiest people in our country get to go into one building and get all of their financial needs met. They get their taxes done, they get their estate documents put together, they get their healthcare needs met, and they get their financial planning done. And all of those people are a unified front. They all lay hands on that individual's financial life. And we've gone about doing that. We had our first tax preparation season in our rearview mirror. Overwhelmingly great reviews. The people who engaged with Lewis and his office overwhelmingly were pretty darn happy. Looking back, I might have put out maybe one fire, and it was really just kind of like a billing issue, which in hindsight really wasn't an issue at all. So tremendous amounts of tax savings we saw with the individuals that engaged with Lewis. In fact, it went so well, Lewis went and poached two of my most important employees. So he's got TJ and Catherine working with him now. So the size of their staff has doubled on the tax preparation component. Of course, many of you guys have engaged with wealth.com. That's our estate planning chassis or platform that we're utilizing to create wills, trusts, medical powers of attorney, financial powers of attorney. We're going to continue to pour into that area of the business. I can totally foresee us hiring a dedicated estate planning individual in the next year or two, kind of low on the priority list, quite frankly, but it's something that we can see ourselves doing. One more big announcement. I know for some of our clients here in the Charleston area, up in the Somerville area, it's a hike to get over to our Daniel Island office. We're going to be opening up a Somerville office. We've heard point blank from a couple people. We don't lose many clients, but a couple people left us and they were like, hey, the reason I left you, we love you guys. I just don't want to travel that far. So that point was taken, and we're going to be opening up a Somerville office to kind of service that area so you don't have to get on the highway for 45 minutes to come see us here on Daniel Island, although we would love to see you here on Daniel Island. Which leads me to the healthcare component. Now, of course, when you sit with your advisors, we can talk to you about securing healthcare under the age of 65, how Obamacare works, how Christian cost-sharing ministries work. Do you just go on the open market plan and our short-term health insurance plan, a bridge health insurance plan to get you to age 65? But after the age of 65 is when Medicare comes in. And as to not steal any of Mary's thunder, today we're going to go over Medicare 101, the basics. Now, I understand some of you are already over the age of 65, and your annual open enrollment period is about to, the doors are about to swing open for that. Mary's going to touch on that, but that's not the point of her presentation today. The point of her presentation today is really Medicare 101, everything that you need to know. Even if you're already on Medicare, though, I guarantee you're going to walk away from today's presentation with a couple nuggets of information that you weren't aware of already. So with that said, I asked Mary Swertik, I said, is that a German name? And the reason I asked her, is it a German name? If you haven't got our invitation to Oktoberfest, we did everything via paperless posts. We did everything digitally this year. So Oktoberfest is going down in Charleston next week, September 30th. Come one, come all. You are invited to Oktoberfest. Okay, but you got to reach out to our company and let us know you're attending. Very selfishly, this is our greatest event where we get to meet clients' friends because I don't do any talking. I do wear lederhosen, as do the rest of our staff, and the women wear drindles. So it's kind of a fun-loving, goofy event where we get to eat Wiener Schnitzel and just kind of make a laugh of ourselves. But come one, come all, bring your friends. September 30th in Charleston. Myrtle Beach will be October 9th, I believe. And then down in Savannah, Bluffton, we're doing it at the end of October. I knew you would I would forget the date, but it's the end of October. You should have gotten the invitation in the mail. If you haven't, raise your hand in the chat, reach out to our office. We'll make sure it goes over to you. So without further ado, and with some compliance slides to boot, I give you Mary Swertick. Mary, the floor is yours.
Thanks. I appreciate it. Well, I'm really excited to be here, kind of go over Medicare. Now, on the agenda for today, what we're going to start off with is the basics of original Medicare. So just how Part A and Part B work by itself. And then we'll also go over your Medicare options. So what can we have in addition to A and B, Medicare eligibility and enrollment, and then just some important dates to save. Also, I do want to touch base a little bit too. He mentioned it, Adam, but we will be having AEP, or the annual enrollment period, coming up soon next month. So even if you're already on Medicare, there's a lot of changes that happen during that time frame. Those changes haven't officially been released. They don't get released until October. So again, even if you have a plan that you like, we still probably want to meet just to make sure it's still going to be available for 2026.
And one other thing, Mary, before you carry on, I didn't really do a good job of kind of bridging your relationship with Curran. So Mary works with an organization called Advisors Excel. Advisors Excel and our firm have been in partnership for over 15 years. And what we like about them is they're independent, agnostic to the companies in which you work with, right? So too many insurance company agents out there are running around selling one particular company, which doesn't result in you getting the best price, in my opinion. So what's so cool about Advisors Excel is they can represent just about every company under God's green earth, and they don't look at it as their responsibility to sell one or the other. They look at it as their responsibility to show you every single plan and option that's at your disposal, shop for the very best rate possible, and then find you the program that's going to be in your very, very best interest. So what we were finding, our advisors were actually doing this in visits, and it would wind up taking 30, 45 minutes of their time. And while I want our firm to represent all facets of the financial planning experience, while I want our firm to be a family office where everything gets done under one roof, it was taking up far too much of their time, and a jack of all trades is an expert at none. So if we were wasting too much time, energy, and effort and intellectual capital focused on Medicare supplements and Advantage and prescription drug plans, that was taking away from their capabilities of being excellent advisors as it related to tax and estate planning and financial planning in general. So we're leaning into Advisors Excel as an ancillary organization attached to ours, and they're going to help through the shopping process for all things Medicare. Sorry, Mary. Should have said that earlier, though.
That's okay. Thank you. Good intro. But anyway, so we're going to start off with just the foundation of Medicare. So we kind of want to look at it like a house, right? So at the very bottom, we're going to have original Medicare. So your Part A, hospital, and Part B, doctor's insurance. So that's the foundation, the base of the house. Now on the sides, we have our optional products. This isn't required. However, just like the sides of a house, it's going to make it a lot stronger. So you have your Part D prescription drug coverage, and then just additional products like dental, vision, hearing, cancer, products that aren't covered underneath just Part A and Part B of Medicare. And then at the very top, we have our roof, which is going to be those Medicare options. So the Medicare options are what you're going to have in addition to Part A and Part B. It's at the roof because it's just going to make those outside forces coming into the house less exposure out of your own pocket, essentially, with A and B. So Part C is normally called a Medicare Advantage plan. And then the other option is a Medicare supplement or a Medigap policy. So those are the same things, Medicare supplement, Medigap policy. They're just interchangeable words. All right. So what we're going to go over next is just how Medicare works by itself. So nothing else in addition to it. I always tell people this is going to sound pretty bad because Medicare is not really intended just to be by itself. So once we go over those supplements and the Advantage plans, most of the out-of-pocket expense that we're going to see on this slide is going to be covered. But we'll start off with Part A, which is your hospital insurance. So things that fall underneath Part A are going to be inpatient stays in the hospital, so overnight stays, skilled nursing, hospice, home health care. Now, typically Part A is free, so as long as you or your spouse worked and paid taxes for 10 years, you don't pay anything for Part A. All right, and so what now the water coming into the boat is going to be is your out-of-pocket expense if you just have Medicare by itself. So let's say you turned 65 or you retired and all you had was that red, white, and blue Medicare card. If you were admitted into the hospital right away and you had nothing else in addition to it, what you would be expected to pay is your Part A deductible, which is that $1,676. Now it says per period, and all that means is it actually resets every 60 days. Okay. So it's not like a normal annual deductible that you have, while you're working, where it's one time a year. This one resets every 60 days. And then on top of that deductible, let's say you're still in the hospital, days 61 through 90, you start to have a $419 daily copayment. Technically, once you pay that Part A deductible, Medicare is going to pay for the first 60 days. I say you did because you paid that deductible. But if you're still in the hospital, days 91 through 150, then you have an $838 daily copayment as well. And then for skilled nursing, Medicare pays for the first 20 days. After that, 20 through 100, you have a $209 daily copayment.
This is how people go broke.
Yeah. So this is why, again, you just don't want to have A and B by itself. Because, as you can see, there's a lot of, holes in the boat, a lot of water coming in. It's really expensive to just have it by itself. Another thing, too, with the skilled nursing is you have to be admitted into the hospital as an inpatient for at least 3 consecutive days in a row in order for Medicare to pay for that first 20 days. So a lot of people don't know that, but that's really important. So that's all of Part A. Now, moving on to Part B, these are going to be things that you're normally going in and getting done. So it's going to be your outpatient services. So like doctor visits, specialist visits. DME is just durable medical equipment. So if you're diabetic and you have to have pumps, test strips, even CPAP machines fall underneath Part B, underneath that DME, and then any preventive services. Now with Part B, there is a monthly premium. Right now, the average premium is starting at $185 per person. Now it is capped at $628. And this is based upon your modified adjusted gross income. I know someone had a question in this in the chat earlier. We're going to go over that in just a second here. I have a whole slide just over the IRMA tax. And then with Part B, there's an annual deductible. So unlike Part A, this Part B deductible is just one time a year. Doesn't reset or do anything crazy. It's $257 for the year. Once you pay that $257, that's when Medicare kicks in. They start paying 80% of your bill, and then you pay that remaining 20%. I know sometimes the 20% doesn't sound bad, but the issue with it is Medicare does not have a cap on it or a medical max out of pocket for the year. So kind of what you're used to with your group coverage or a marketplace plan, you might have a $5,000 or $10,000 medical max out of pocket. Worst case scenario, X amount of money is all you have to worry about for the whole year if anything happens to your health. Medicare A and B does not have a max out of pocket. So again, that number could be infinite. And then on top of that, there is a Part B excess charge of 15%. All this means is if you go to a doctor or hospital that does not accept Medicare's assignment for a procedure, so let's say they don't accept how much Medicare is basically going to pay them, they can bill you an additional 15% on top of whatever Medicare normally charges. So again, that could be pretty expensive.
I could
So
tell you
again,
that trend is. I could tell you that trend is increasing too, because of the
yeah,
insurance company squeezing the doctors. So, one man's
yeah,
opinion.
exactly. And most surgeries nowadays too are actually outpatient. So a lot of times you go in the morning, you get your surgery done, and then you're going home the same day. So yeah, you're going to see a little bit more of these excess fees probably pop up, like you said. But basically, we have the boat here, a lot of holes, a lot of gaps coming into the boat. So we're going to see how we can kind of fill those and how you don't have all that out of pocket expense.
Got a question saying, did you just say monthly Part B premium is 185 to 628? Yes, you did.
Yeah, yep. So
It
it
comes out of
starts,
your Social Security. I think some people aren't aware of that.
yeah. So if you're not drawing Social Security prior to turning 65, or even like some people retire post 65, like they worked, they were on their group coverage, and they want to wait to draw Social Security till a later age, that's fine. The government is just going to send you a bill in the mail for Part B. Okay. But yes, the Part B premium starts off right now at $185 per month, and then it is capped at that 628.90. Now this chart right here is the IRMA chart. So it's your modified adjusted gross income. So if you're signing up in 2025 for Medicare, the government's going to look at how you filed your taxes and how much you made in 2023. So they always look back 2 years previously. So this is that chart that we were talking about. So you can see Part B starts off at 185, and then just depending on how you file your taxes over to the other side, you can see income, how much you're going to charge. They're going to charge you for Part B. There is a form that you can fill out. It's the SSA-44 letter, and we can help you fill that out too. But basically, if you fall underneath one of these higher Part B premium and Part D premium categories, we can fill it out, see if we can get that lowered for you. It's not guaranteed. It's kind of case by case, but there is that option.
Isn't it prototypically, basically that form denotes a unusual event with your income? And
Yeah,
retirement is an unusual event, right? Your income dropped because you no longer work, sale of a business,
exactly.
big capital gain or something.
Yep, yep. And I believe that there's 8 different qualifications that you can choose from on that form too. Now we're going to go over the next part. So kind of the roof of the house. What can we have in addition to Part A and Part B? So again, as we already know, there's a lot of holes, a lot of gaps. It's really expensive just to have Medicare A and B by itself. So the first option that we can choose from is that Medicare supplement or Medigap policy. They started back in 1966 and there are plans available. Now, Medicare supplement plans are standardized and they're sold by private insurance companies. These plans are going to be a lot easier to shop around for versus the Advantage plans because they are standardized. So they're legally regulated by the federal government. So one supplement legally has to work the same way as another supplement with another company. So there's a lot of different carriers that sell the supplements. They all have to work the same way. Basically, the only difference is a monthly premium. And they're going to help cover the gaps that we just saw with original Medicare. So those co-payments and deductibles. So I'm going to go over the 2 most popular options. I want to start off with the Plan G. The way that the Plan G works is it's actually going to come in and it covers all of Part A of Medicare. So that deductible that resets every 60 days, that's covered by the Plan G. All those daily co-payments of you're in the hospital and skilled nursing, those are also 100% covered. It's going to pay for the first 3 pints of blood, hospice, the skilled nursing, Part A deductible, like I said. It's also going to cover that Part B excess fee of 15%. So that's covered. It also has up to $50,000 of foreign travel coverage with a lifetime max. So this plan's really good if you do plan on traveling in or outside of the US, because also there is no network restriction technically with the supplements. So if you're a snowbird, or you plan on traveling, the supplements are a really good option because they will travel with you state to state, and you do have the $50,000 of foreign travel coverage. But basically, as you can see, the only hole that it has or gap is that Part B deductible. So the only thing the Plan G does not cover is that $257 annual deductible with Part B. So that's as full coverage as you can get nowadays. Some people may be grandfathered in on the very far side. You can see the Plan F. It's almost identical to the Plan G. The only difference is it covers the Part B deductible. So it just pays for everything at 100%. The Plan F does. You can't get the Plan F if you turn 65 after January 1st of 2020. So the government stopped letting insurance companies sell it to people who turn 65 after that date. If you turn 65 before then, you're eligible for the Plan F. But the next best thing is going to be the Plan G. Now looking at the Plan N, so this is, again, pretty similar to the Plan G. This is going to be the second most popular option for supplements. It still has no network restriction, so you can go to any doctor or hospital you'd like. It does have the $50,000 of foreign travel coverage included, but there's two key differences between the G and the N. The first difference is going to be if you have to go see a specialist, you have up to a $20 copayment. With the Plan N, you don't have that with the Plan G. And then for any emergency room visits, you have a $50 copay with the Plan N, where you don't have that with the Plan G. And then basically the only other difference that you have with the Plan N that the Plan G covers is that excess fee. So if you get the Plan N, it doesn't cover that 15% excess fee like the Plan G does. And then as you can see, it still doesn't cover that Part B deductible. But other than those, go ahead.
Just to highlight something that Mary said that I think, a lot of individuals don't know. Plan G with Bob's Insurance Group and Plan G with Mutual of Omaha and Plan G with Blue Cross Blue Shield is the same exact plan. It's the same plan. It has the same details. So it's really up to you to find the best pricing coupled with the best carrier, right? Because if you work with Bob's Insurance Company, they might not have good customer service. Now, how much you're going to use that customer service, I don't know. So you kind of have to weigh those things, which, I defer to Mary. And then one other thing, Mary, I think you'll probably cover it, but the annual open enrollment period is a time in which you can reshop your plans, but you are required to go through medical underwriting, correct?
Yes. Yep. So we have a slide to go over this, but basically everything he said was right. So a Plan G with, X company legally has to work the same way as a Plan G with Y company. The only difference is a monthly premium. Another big thing that is a difference where I would recommend some carriers over others is going to be history. So like he said, once you're past a certain point, and we'll go over the slide, if you signed up for one company and you're like, oh, this was really cheap when I first turned 65, but now I'm 70 and I'm paying $500 a month for a Plan G. I want to see if I can shop around for a cheaper Plan G. Well, at that point, there's certain timeframes where they can't ask you any health questions. And once you're past that time frame, if you try to switch, they can legally ask you health questions. So it's important that if we sign you up for a supplement, that we're signing you up for a carrier that I know historically is going to be affordable, not just now, but potentially 5-10 years down the road if you can't switch, because some people might not be able to. And so we just don't want you stuck with a carrier that's really, really cheap the first year and then just jacks up their rates, a year down the road and you can't switch.
This is what insurance companies love to do, kind of rug pull. Couple quick questions. I think you can answer this first one quickly. If you're 100% covered by the VA, can you opt out of Medicare entirely?
Technically, I guess you can. I don't know if I would recommend that, because if you go to the VA and something's not covered, well, then who else are you going to have? You need to have Medicare put in place. So usually people who have VA, I recommend sign up for A and B, just because, again, if it's not covered, you need to have some sort of
Doesn't
health
TRICARE
insurance.
for Life, to my understanding, probably a better thing to take offline, but to my understanding, TRICARE for Life almost acts as a supplement to a certain degree, but you continue to have A and B. And then by foreign travel, you are specifically saying it covers you between states, not foreign countries. No, it's foreign countries.
Yeah, so the supplements, you can travel state to state. So we have a lot of clients that are snowbirds. They live half the year South Carolina, half the year somewhere else. So the supplement is great because if something happens when you're in a different state, it's going to cover you no matter where you're at. But then also, if you travel outside of the US, you have up to $50,000 of foreign travel coverage with the G and also with the Plan N.
So I think, yeah, both of those things, but I think between states, it becomes a lot more important as you start comparing a supplement to an advantage program. So
yeah,
sorry.
you cut out for a second, so I didn't get the last part of that.
When you look at state differences, it's comparing a supplement to an advantage program, perhaps. So I'll give the floor back to you.
Okay. Yeah, and then this one, that may be different depending on the state you live in. In Idaho, for example, you can change plans without going to. Yes, so that is, I have a slide on that. That's going to be state specific. So I don't want to talk too much about birthday rules, or it's called a guaranteed issue right. There's certain states in the United States where, like Idaho, California is one of them too, Illinois, where every year on your birthday, you have a set amount of time after your birthday to basically switch to another med sup carrier. So if you have a Plan G, you can see if, hey, is there another Plan G that's cheaper? And they can't legally ask you any health questions. But that's not in every state. That's only certain states. So if you are in one of those birthday rule states, definitely contact me because it's worth it to check, every year on your birthday, see if we can get you something cheaper.
I won't interrupt you anymore, Mary. I can't promise that, but I'm going to try not to.
No worries. Okay, so this is going to be that boat that we have with all the water coming in, and it's just going to explain what the Plan G is covering again. So it's going to cover that Part A deductible of $1,676 that resets every 60 days. So that's taken care of. It's going to pay those daily co-payments of $419, the $838, the $209 skilled nursing. So basically all of Part A is covered. And then it's going to cover that 20% that has no cap. And it's also going to cover that 15% excess fee. So again, medical max out of pocket with the Plan G is $257 for the year. So it's as pretty much comprehensive as you can get. Again, no network restriction. Go to pretty much any doctor or hospital you'd like, as long as they accept original Medicare, which over like 98% of providers and hospitals do. They, by law, have to accept whoever you have for your supplement, whether it's with Y company, Z company, A company. So it's very easy to shop around for these carriers for the Plan G. Okay, so now we're going to go over that second option that we can have in addition to Medicare A and B, which is going to be a Medicare Advantage plan, or Part C. So you have to choose either the supplement or the Advantage plan. You can't have both. So the Advantage plans, they started back in 2003, and they just act as that second option or second choice that you guys can choose from. Sometimes they're called Part C policies. They're sold by private insurance companies as well. And these plans are the benefits are going to vary in a lot of different ways. So they're not all going to be the same. So these ones are a little bit harder to shop around for because the benefits are all going to be different from plan to plan. I will say with the supplement, you have to pay a monthly premium for like the Plan G, but usually with the Advantage plan, there's low to no monthly premium. So this option is going to be a little bit cheaper up front for monthly premiums. The annual max out of pocket costs are going to be different from plan to plan, and the co-payments and co-insurance. So the way that the Part C or Advantage plans work is everything's combined. So your Part A medical, Part B is all in one plan. It's typically going to include prescription drug coverage, and they may offer other benefits outside of traditional Medicare. So a lot of times they'll market like they might have a little bit of dental coverage. a free gym membership. So these plans do a lot of marketing. So most of the things that you see on TV, the commercials, are going to be the Advantage plans. And then on the other side, we just have some common copay examples for the Advantage plan. So pretty much every time you go in and get something done, you can expect to see a copay. So it's kind of like pay as you go plans. So just kind of comparing the difference in coverage. Option 1 is a Medicare supplement. You do have to pay the monthly premium. So you pay the Part B premium, the $185 plus whatever it is for the supplement. So it's going to be a little bit more expensive up front. However, a lot lower max out of pocket. The plans remain the same with each carrier, so they're standardized. There's no network as long as they accept original Medicare. It's guaranteed renewable. This is really important because they're not going to cancel your coverage as you get older and your health changes. As long as you pay your premiums, you're good to go. They can't cancel your coverage. Underwriting is required except during your initial enrollment period. That's when you turn 65, we'll go over that, and your special enrollment period. I'll also go over that enrollment time frame too. Option 2 is that Medicare Advantage plan. It usually is going to be $0 monthly premium, but no matter what option you go with, you'll always have to pay your Part B premium. So no matter what, you're always paying that Part B premium to the government. It's state-based and county-based. Benefits vary by plan, and there is network. So you have to see the doctors and hospitals within that plan's network usually. Approved annually by CMS. This is really important because especially since we have AEP right around the corner, you may have had a plan for 2025 that you really liked, but depending on what's changing, you should get your annual notice of changes, usually like this month or in October, no later than October, you should get it, but it'll tell you what's changing in your plan for the upcoming year. Or some of the plans aren't even going to be available. They're just ending that plan for 2026. And so if that's the case, we always want to just make sure hey, do you like your plan? If it's ending, we need to change you to something else. So you kind of have to stay on top of these every year. So I was just saying no underwriting is required with the Advantage plan, so they don't ask any health questions. All right, and then going over Part D, or your prescription drug coverage, they started back in 2006, and they're just there to supplement your outpatient prescriptions. So any prescriptions that you get, they're sold again by private insurance companies, and it is an optional benefit, but it's intended to help you guys pay or reduce your out-of-pocket costs for your meds. It says it's optional, but there is some drug plans that are very low, like lower than $5 a month. Some of them are 40 cents or $0. So it's a pretty good idea to sign up for one, because if you don't, when you're eligible and down the road, you end up taking more meds and you need coverage, you get penalized for every month you could have and you didn't sign up. So again, it's optional, but there's a lot of affordable drug plans. Okay, so this next slide, we're going to go over the prescription drug coverage stages. There's 4 different stages. Now, the way that the first stage works is it's called the deductible stage. So at this point, you're responsible for 100% the cost of your prescriptions until you meet the deductible. The deductible right now for all the drug plans for 2025 is capped at $590 for the year. I will say some plans, so some of these drug plans have a $0 deductible. So not all of them are going to have the $590. It can be 0, but it's capped at $590.
Got a question. Do the drug plans list what they cover, for example, diabetes meds?
Yep. So if we talk, I'm going to get a list of all your medications at the time that we talk. And depending on your med, we'll sign you up for a drug plan that covers pretty much all your meds underneath the formulary. So all the drug plans cover meds a little bit differently. Again, drug plans change every year too during AEP. So it's good to always touch base during that time if you have a drug plan, just because one med that was covered for 2025 might not be covered or underneath their formulary for 2026.
And then another question, what happens if you choose an Advantage plan and you are a snowbird?
Yeah, that's a really good question. It just kind of depends. So if you have a PPO where you can go in and out of network, that can be okay. I don't recommend if you plan on traveling usually to get an Advantage plan, just because even if you go out of network, it's not guaranteed that there's going to be any doctors or hospitals that are in that PPO's network. So if you go out, you're going to have a lot higher of a cost share amount. Basically, I wouldn't recommend the HMOs, which are the health maintenance organization plans. Those ones you have to see the doctors and hospitals in that plan's network. Otherwise, the plan won't pay. So usually if you plan on traveling, the Advantage plans aren't always going to be the best option. The only one that I would really maybe recommend is a PPO.
And that kind of answers Forrest DeLong's question about being a retired law enforcement officer. So yeah, some of this stuff, it's really just call your office, your people up and go over your unique situation.
Yep. Yeah, because he mentioned a lot of times too, when you're a retired worker, like you worked for the state, they'll offer a certain Advantage plan. And sometimes those Advantage plans can be pretty good. It's a retiree sponsored Advantage plan. So it's different than what anyone else can get on the marketplace for the Advantage plans. So a lot of times we'll kind of compare and go over, hey, how does this look compared to if you were to get your own supplement or get an Advantage plan on the marketplace? So yeah, that's probably something we want to meet with. And then if you have TRICARE for life, you don't usually need anything else in addition to it. So usually you just want to have A and B, and then TRICARE for life is just going to be a super good supplement. Pretty much covers everything for you. Okay, so after you hit that deductible, you go into the initial coverage stage. At this point, you pay 25% of the cost of your medications. Once you pay up to $2,000 worth, that's the max. So that's the cap on all the drug plans for the year. So max out of pocket is $2,000. Once you hit the $2,000, you hit the catastrophic stage or the third stage. At that point, all your medications are going to be 100% covered. And then after that, the plan's going to restart January 1st of every year. So Medicare eligibility at age 65, you become eligible for A and B, even if you still work. Even if you continue to work past 65, you might not need to sign up for Medicare if you have credible group coverage. So that's something that I would want to talk to you about. So that way you don't sign up if you don't need to. You may be eligible for Medicare through your spouse, although you still must qualify by age or disability. So if you stayed home, took care of the kids, and you weren't working, and you didn't have those 10 years paid into taxes, that's fine as long as your spouse did. You would also qualify. And then some people qualify for A and B if they're under 65, if they have a disability. And then just how to enroll. SSA.gov is the easiest way to enroll. You can go over the phone, or what we said earlier, if you're drawing Social Security or the railroad retirement benefits prior to 65, you're automatically enrolled and usually get your card about 100 days before your Part A and Part B start. And this is that initial enrollment period. So when you can sign up for Medicare, if you're turning age 65, you have 3 months prior to your birthday month, and 3 months after. If you retire after 65, so you decided to work, you didn't sign up for Medicare because you had group coverage, that's fine. You're going to have what's called an 8-month window or special enrollment period after losing your group coverage to sign up and not be penalized. And then the IEP also applies to people who are newly qualified for Medicare due to a disability. And then on this chart, it's if you're turning 65 in July, earliest you can sign up is April 1st. The last month you can sign up is October. And then the Medicare supplement open enrollment period. So when can you sign up for a supplement like the Plan G we talked about? That starts the month of your Medicare Part B effective date, and it's going to last 6 months after that. So you get quite a big time frame to sign up and not be asked any health questions. And then the special enrollment period is a guaranteed issue right of another qualifying circumstance. So loss of coverage, you work past 65, The government will give you an 8-month window after losing group coverage to sign up for a supplement and not be asked any health questions. The next 3 are going to be Advantage plans. So if whether a pandemic, 5-star plan, moving out of the plan area, so you're leaving one state, going to a new state, you can get a different Advantage plan. State-specific guaranteed issue changes kind of answer that question. Certain states allow you on your birthday to switch to a cheaper Plan G if there's one in your area with no underwriting. And then AEP, annual election period is October 15th through December 7th. This is where you can switch from original Medicare to an Advantage, vice versa, switch from an Advantage to another, enroll in a Part D plan for the first time, but you may get a late enrollment penalty, or you can switch from one Part D plan to another. So we definitely want to touch base during this time frame if you're already on Medicare, just to make sure that the plan you have is still going to be the best plan for 2026. This is just my contact information. So if you guys want, you can always scan that QR code. It'll have my calendar link for you to set up a meeting. I think we'll add one in the chat, just a link for you to click to set up a meeting. But that's my contact information too. Email, phone number. So just let me know if you guys need anything.
Let me hit a couple questions while we got you, Mary.
Yeah.
It's my understanding that if you have Part D, there are many insurance plans that will not allow you to use discount cards. Can you speak to this? Yep.
So if you're going to use like GoodRx, you can't run both your insurance and GoodRx. So sometimes, if you're going to use GoodRx and it's cheaper versus a copayment for your insurance or underneath Part D, just use GoodRx. You can't use both.
Good question. If you select a national carrier for a Medicare Advantage plan, you can usually find in-network provider in most states. I don't know if that's a comment you can really even comment on. He's saying if you have Medicare Advantage, you can usually get a provider in your state.
Yeah, it just kind of depends on the plan that you have and what the network is.
Probably also depends on the specialist you're looking to see as well, which that's a difficult one to answer in a blanket way. But good to know. When will we know what the Plan B premium is so we can start the appeals process if we need to?
Yep. So you won't know what they're going to charge you for Part B until after you apply. So once you apply, usually it takes about 2 to 4 weeks for you to get that Part B premium bill sent out to you in the mail. And that's where you'll know if you're going to pay a higher Part B premium.
Can we get copies of the slide? Wayne, I'll send you these slides. I got no problem with that. Okay, is South Carolina one of those states that has no underwriting during your birthday month? That's every state, correct?
No, it's not every state. South Carolina is not one of the states. They're not a birthday rule state.
No, but she's saying no underwriting during your birthday month for a Medicare Advantage or supplement plan.
Are you asking when you turn 65? Because when you turn 65, they can't ask you any health questions. But if you're asking, is it one of the birthday rule states where every year on your birthday you can switch and not be asked any health questions? It's not one of those states.
Okay, you're correct. I'm sorry about that. I just assumed he's talking about his 65th birthday. Okay. What was the date mentioned for Plan N not being available?
Oh, the Plan F, you have to be grandfathered into the Plan F, so you have to have turned 65 prior to January 1st of 2020.
Okay, awesome. Does Plan F include a $50,000 for international travel?
Yes.
What if I'm living outside the U.S.? I turn 65 in 2026. Is Medicare mandatory?
I mean, it's not mandatory. It just depends on how long you're going to live outside of the U.S. Usually if you live outside of the U.S. for, over 6 months to a year, I don't even know you might want to get health insurance through this country, that you're going to be living in.
I was referring to annual changes, Chuck. Yeah, so he wasn't talking about his 65th birthday. He was talking about the birthday state. So you were spot on. All right, man, y'all are throwing the kitchen sink at Mary. You guys all got, you look at some of these questions, it's like people are saying hello from Italy and Canada. And
yeah,
gosh, I'm like awestruck. I thought my little company just helps people down the road in the dirt roads of South Carolina, but you guys are some jet setters.
Nice.
All right. Yeah. So look, if you're not yet 65 and you're in that window, you'd be crazy not to lean into Mary and her team. If you already have an Advantage or a supplemental plan, I'm of the thought that's just something you ought to shop. Maybe not every year. Maybe you're not someone who does it every year. But every 3 to 5 years, why not see if you can get a better deal? So there's the QR code. Also, if you go to our website, the retireall.com website, there's a tab that says Medicare, and it has a direct link to a Calendly link that you can get on Mary's calendar or someone from her team. Where are you located? I'm not going to ask you where you're located, Mary, because you just had a baby. You're probably Mama Bear. I'm not telling you where I'm located. But she ain't in our office. I'll tell you that, right? So the AE Medicare team, based out of Topeka, Kansas, but I think your teammates are all across the country. You guys are kind of virtual nomad type people.
Yep.
But these are the individuals we want to lean into because they see the world through a similar lens, that being an independent one. Too many Medicare advisors are selling Blue Cross Blue Shield or Mutual of Omaha, or not to pick on those companies. Those are excellent companies. But in my opinion, you can't be objective. You can't be agnostic if you're running around like a hammer, looking at everyone like a nail, trying to sell one particular product. So pick up the phone, call these individuals, or schedule some time with them to try to find the very, very best deal for you and your family. Do you have any comments on Medishare type arrangements? I could comment on Medishare. I personally use Liberty Health Share. Claire and I had 3 or 4 babies on Liberty Health Share. It's not Mary's shtick. This is for individuals under the age of 65. I did a podcast, and the title of the podcast is Health Insurance for People Under the Age of 65. And I'm happy to share that with you, John. And it talks about cost-sharing ministries, short-term health plans, as well as gaming Obamacare by keeping your income low and getting a big subsidy. So I think that's all of them. Mary, thank you. Y'all, thank you so much. I hope to see many of you at Obamacare. I hope to see many of you at Oktoberfest. They both start with an O. Next week, or up in Myrtle Beach a couple weeks from now, and maybe even down there in Savannah, Bluffton a few weeks from now. Thanks so much, Brittany. Thanks for posting that podcast too. Mary, I appreciate you. Thanks for helping our clients so well.
Yeah, thank you. It was nice meeting with you. And yeah, like you said, if you guys have any questions or already on Medicare, definitely schedule a meeting, and I'd be happy to do a plan review for you guys. Or if you're turning 65, just schedule an appointment with me.
Awesome. Bye, y'all.
Bye.